The first time a new strain of coronavirus, first found in South Africa, is discovered here in the U.S. 2 cases have been detected in South Carolina. Scientists say this strain is highly contagious, and the other main concern here is that the vaccines don't seem to be as effective in fighting it. Moderna and Pfizer both say they are working on tweaking their vaccine, so they would essentially add a booster to make their shots more effective against these variants, and of course this will take time. We have a lot of major developments to dissect today. Joining me this morning, Dr. David Winter from Baylor Scott & White Health. Good morning, Dr. Winter. Let's get right to it. What can you tell us about this Johnson & Johnson vaccine? It does sound promising.
Yeah, I'm excited about this. Sonia, there's only 6% of all Americans as of the first this week who've been vaccinated. 94% would like to get a vaccine. The 2 companies out right now, there's not enough, so we welcome this new vaccine. As you mentioned earlier, this has potentially 3 important advantages. 1 shot, it doesn't have to have those super freezers, and it looks like from the studies, it has potentially less side effects. So excited to have this new vaccine out there. We need this one and more, Sonia.
Yeah, and we've still got a little time. It's got to go through the FDA process and emergency use authorization. In the meantime, though, Dr. Winter, we've seen a sharp decline in cases, down 33% across the country since the beginning of January. Hospitalizations and deaths are down each by about 10%. Do you say that we're at a turning point in the trajectory of this virus?
Well, I'm excited to hear those numbers, but I tell you, there's still a lot of coronavirus out there, so it's still highly contagious. I'm going to attribute this to the fact we're masking, distancing, and disinfecting our hands better. If we let our guard down, it will come back. We're not anywhere near herd immunity. You've heard that term before. We got to keep protecting ourselves because this virus is going to jump to another person, another person, another person if we let our guard down. So, yeah, I'm excited right now, but I'm still worried about the future with this virus.
Yeah, cautious. I'm glad you mentioned herd immunity. About 1/3 of the country has been infected at this point. So what is herd immunity? Can you just clarify?
Yeah, if enough people have immunity to the virus, either from a vaccine or because they had the condition, COVID-19, before, then the virus will eventually die out. How much is that? Well, scientists tell us it's 60 to 70% of the entire community, the entire country for that matter. We're a long way from that. So we still need to be very careful with this very contagious virus.
Okay, Dr. Winter, one of the big questions I've been getting this week from folks, should we be wearing double masks? I started doing it, I will say, a few days ago. So who and when and why should we do this?
Yeah, let's talk about how masks work. So a mask is designed that it's going to trap the particles. Here's the N95, the Big Daddy. This one has a lot of layers fused together. So by the time the virus goes through this mask, it gets caught, it gets trapped and doesn't get to your mouth or your nose. This works well. Hard to get these, they're uncomfortable, I understand. But if you have a thick cloth mask, this also does the same thing. A lot of channels for the virus to go through before it gets caught, and hopefully gets caught before it gets to you. So thin cloth mask, no. Thick cloth, yes. How about double protection? So I like this idea a lot. If you're in an area where there's a lot of people out there you don't know, and you're going to be closer to them than you like, this is the idea I would go with. Maybe you don't need it all the time, but double masking is probably double good.
Okay, all right, good to know, Dr. Winter. I want to go back to the discussion on variants. We know of at least, I think a lot of people are talking about 3. I've been reading about 4. So, of course, the UK variant, the South African, the Brazilian, and there's this California variant that we're starting to hear about. We know most about the first 2. The British variant, they're saying, is 1.5 times more likely to infect people. How does this happen?
Yeah, the virus attaches to certain particles in our body. It's that spike protein on the outside of the virus. It has the affinity for parts of our body, particularly in the lungs. And some of these new mutants, they have more of affinity for that. Viruses mutate. That's what they do. They're going to continue to do that till we get this virus off our planet. But even the mutated variants, they respond to the masking, distancing, and disinfecting. So that's the key message. Until we get more people vaccinated or more people past the COVID virus itself, we're going to have to keep doing that because more variants are likely to come.
So does this mean that if you've had COVID already, you could get the virus or the disease again, but just a different variant.
Yes, indeed. I've actually had 3 patients who've had it twice now. One person had it within a month of the other. The other 2 had them a couple months earlier. So if you've had COVID virus, the COVID-19, then you have antibodies that should protect you, but not completely. And how long do they last? We don't know that quite yet. We have to continue to guard against this virus because right now we don't have enough knowledge to know if you're immune for 1 month, 3 months, 12 months. The same with the vaccine. How long will that last? How long will the immunity last? Only time will tell.
Yeah, it sort of seems endless right now. Dr. Winter, thank you so much for your time today.
You bet. Thank you. Have a good weekend.